Okay, so today we're diving into something that might be a little bit delicate for some.
Yeah, maybe not a dinner table conversation.
Exactly. Hemorrhoids. But, you know, let's be real, it's super common.
It really is. And it's nothing to be embarrassed about.
Absolutely. And you know what's interesting? Everyone has anal cushions. Those are the things that actually become hemorrhoids.
That's right. They're a normal part of our anatomy. They help us with bowel movements, act like a seal.
So they're actually important.
Oh, yeah, crucial for everyday function. They're like this natural padding filled with blood vessels and tissue to protect the muscles in our anal canal.
Hmm. Like a little built-in cushion.
Yeah.
So what happens when these cushions go wrong?
Well, that's when they become what we call hemorrhoids.
Okay, so let's talk about that. What are the different types of hemorrhoids?
So we have internal hemorrhoids and external hemorrhoids.
And what's the difference between the two?
The main difference is their location. Internal hemorrhoids are located inside the rectum, above a line called the dentate line.
Dentate line. Got it.
And because of where they are, they often don't cause any pain. You might not even know you have them.
Really? Why is that?
Well, the area above the dentate line doesn't have as many pain receptors. Think of it like biting the inside of your cheek, not as painful as biting your tongue or your lip, right?
Okay, that makes sense. So internal hemorrhoids are kind of sneaky.
They can be. Now, external hemorrhoids, on the other hand, are a different story.
I'm guessing those are the ones we feel.
You bet. They develop below the dentate line, and that area is packed with nerve endings.
So like our fingertips or lips. Super sensitive.
Exactly. So when those external hemorrhoids flare up, you definitely know it.
Ouch. So location is key. Above the line, potentially painless. Below, oh boy.
You got it. And to add another layer of complexity, internal hemorrhoids are classified into 4 grades.
Grades, like in school.
Kind of. They're graded based on their size and whether they prolapse or not.
Prolapse, meaning,
They can actually bulge or protrude outside of the anus.
oh, I see. So there are different levels of severity.
Exactly. And sometimes this is where things can get a bit tricky.
How so?
Well, sometimes people will have symptoms, but they think it's just hemorrhoids and they wait way too long to see a doctor.
I can see that happening.
It's understandable. But I can't stress enough the importance of getting checked by a doctor, especially if you're experiencing any rectal bleeding.
Because it could be something more serious.
Exactly. There was even a case where a patient dismissed their symptoms, thinking it was just hemorrhoids, and it turned out to be something much more serious.
Wow. That's a good reminder that self-diagnosing is never a good idea,
Hmm.
especially when it comes to something like rectal bleeding.
Right. Any rectal bleeding should be checked out by a doctor, no matter what. Now, I know you're probably wondering what causes hemorrhoids in the first place.
I am, actually.
Yeah.
What puts those poor little cushions under so much stress?
Well, a lot of it comes down to our modern lifestyle. We spend so much time sitting, at work, commuting, on the couch.
On the toilet, probably scrolling on our phones.
You got it. All that sitting puts pressure on those veins in the rectal area, which can lead to swelling.
Makes sense. So basically, our behinds are paying the price for our sedentary lifestyles.
In a way, yes. And then there's the issue of straining during bowel movements.
Which brings us back to the importance of fiber.
You're catching on. Fiber is crucial for keeping things moving smoothly through your digestive system.
If you're not getting enough fiber, things get backed up, and that leads to, well, more straining.
Exactly. And straining puts a lot of stress on those anal cushions.
It's all connected.
It really is. And there are other factors that can contribute to hemorrhoids as well.
Like what?
Obesity, pregnancy, even just getting older.
So it's not just bad bathroom habits, it's a whole lifestyle thing.
You could say that.
Okay, so we've talked about what hemorrhoids are and what causes them. Now let's get to the part everyone wants to know about the symptoms.
Yeah.
What should people be on the lookout for?
Well, with internal hemorrhoids, the most common symptom is painless rectal bleeding. You might notice bright red blood on your toilet paper or in the toilet bowl.
But you said internal hemorrhoids are often painless.
That's right. So you might not feel any pain, but the bleeding is a sign that something's going on.
Okay, so bleeding, even without pain, is a red flag.
Absolutely. Now, with external hemorrhoids, the symptoms are usually more noticeable.
Like pain.
Yes, pain is a big one, especially when sitting.
I can imagine that would be uncomfortable.
It can be. You might also notice swelling or lumps around the anus, and there could be itching or irritation as well.
Yikes, that sounds pretty unpleasant.
It can be, but the good news is there are things you can do to find relief.
Like what?
Simple things like taking warm baths, using over-the-counter creams, and of course, eating more fiber.
So let's dive into those a bit more. Let's start with warm baths. How does that help?
Warm baths, or sitz baths as they're sometimes called, can help soothe the area and reduce inflammation.
I can see how that would be soothing.
Yeah.
What about the creams and ointments? Do they really work?
They can provide temporary relief from the symptoms. Some contain witch hazel, which can help with swelling. Others have hydrocortisone, which is good for inflammation and itching. And some even have lidocaine, which is a numbing agent for pain relief.
So a whole pharmacy for your behind.
Pretty much. But it's important to remember that those creams and ointments are really just for symptom relief.
Not a cure.
Exactly.
Hmm.
And that's where the lifestyle changes come in.
What's the #1 tip for preventing hemorrhoids?
I bet you can guess this one.
Let me guess. Fiber.
You got it. Fiber is absolutely crucial for preventing hemorrhoids.
So it's not just about treating them, it's about stopping them from happening in the first place.
Exactly. Adequate fiber keeps things moving smoothly through your digestive system, so you're not straining as much.
And less straining equals less pressure on those anal cushions, which means
Fewer hemorrhoids, it's all connected.
it's all making sense now. So how do we actually get more fiber? What are some good sources?
Well, think fruits, vegetables, whole grains.
So like berries, broccoli, brown rice.
Yes. And legumes, too, like lentils and beans.
And let's not forget nuts and seeds.
Oh, absolutely. They're packed with fiber and healthy fats, great for a snack.
Okay, so lots of good food options. But what if someone's still struggling to get enough fiber from food alone?
That's where fiber supplements can come in handy.
Are all fiber supplements created equal?
Not necessarily. It's best to chat with your doctor or a registered dietitian to figure out which type is best for you.
They can help figure out the right dosage and make sure it fits into your overall diet.
Right, and it's important to introduce fiber gradually.
Why is that?
Well, suddenly adding a lot of fiber can cause gas and bloating.
Ah, that makes sense. So start slow and let your body adjust.
Exactly. Now, besides fiber, staying active is another important factor in preventing hemorrhoids.
Really? How does exercise help?
Well, regular exercise helps keep your digestive system working properly, and it can help prevent constipation.
So getting that blood flowing and everything moving.
Exactly. Aim for at least 30 minutes of moderate intensity exercise most days of the week.
And it doesn't have to be anything too strenuous, right?
Not at all. Brisk walking, swimming, dancing, anything that gets you moving is great.
The important thing is to find something you enjoy and make it a regular part of your routine.
Speaking of routines, let's talk about bathroom habits.
Oh yeah, what should we be doing or not doing?
One of the biggest things is to avoid prolonged sitting on the toilet.
You mean no more scrolling through social media while on the throne?
I know it's tempting, but it's really best to avoid it. The longer you sit there, the more pressure you're putting on those veins in the rectal area.
So keep it brief.
Exactly. And it's important to listen to your body's signals. When you feel the urge to go, don't hold it in.
That can't be good.
No, it's not. Ignoring those urges can lead to constipation, which, as we know, can contribute to hemorrhoids.
It's a vicious cycle.
Yeah.
And speaking of things that keep things moving, how about hydration?
Hydration is essential. Water helps fiber work its magic.
So it's like a dynamic duo, fiber and water working together for a healthy gut.
Exactly. Make sure you're drinking plenty of water throughout the day.
So we've got fiber, exercise, healthy bathroom habits, and hydration. These all sound like good habits for overall health, not just for preventing hemorrhoids.
Absolutely. And the great thing is, even if you've already had hemorrhoids, adopting these lifestyle changes can make a big difference in preventing them from coming back.
So it's never too late to make these changes.
Never. But remember, consistency is key. It's not about doing a crash diet or an intense workout for a week and then going back to old habits.
So it's about making gradual, sustainable changes that you can stick with over time.
Exactly. Think of it as investing in your digestive health. And honestly, that's an investment in your overall well-being.
Well said. Now, before we move on to the final part of our deep dive, where we'll be tackling some common questions about hemorrhoids.
We want to remind everyone that this information is for educational purposes only.
It's not a substitute for professional medical advice.
Always consult with your doctor for diagnosis and treatment recommendations.
They're your best resource for personalized care.
So if you're thinking, okay, the fiber, the sitz baths, like I've tried it all, what's next? Well, this deep dive is for you.
A lot of folks find themselves in that situation. They've done what they can at home, but aren't sure what the next step is.
Right. And that's where a doctor comes in. They can assess the situation, recommend the best course of action. And one of the most common interventions we're seeing, especially for internal hemorrhoids, is something called hemorrhoidal banding.
It's often the go-to when those simpler treatments aren't enough, especially with internal hemorrhoids.
Hemorrhoidal banding, I'm picturing like tiny rubber bands. Where are those going exactly?
It sounds a little more intimidating than it actually is. Basically, the doctor places a small rubber band around the base of the hemorrhoid inside. This cuts off its blood supply so it shrinks and eventually just falls off, all internally. You don't have to worry about incisions or anything like that.
So it's like a mini procedure right there in the doctor's office. I guess that's why it's so popular compared to some of the other options.
It is, yeah. Minimally invasive, usually doesn't need anesthesia. Recovery's pretty quick, too. People can generally get back to their normal activities really soon after.
Mhm.
And studies are showing it's very successful, up to 90% success rate in some cases, especially for certain types of internal hemorrhoids.
Hold on, certain types, meaning it doesn't work for all hemorrhoids.
Right, it's not a one-size-fits-all kind of thing. Doctors use a grading system to classify hemorrhoids based on their size and how severe they are. So banding works best for grade 1 and 2 internal hemorrhoids. Those are the smaller, less severe ones. And sometimes it can be used for grade 3, which are a bit bigger, but it's not suitable for everyone with that grade.
So what about external hemorrhoids or those more severe grade 4 internal ones? What are the options in those situations?
Things get a little more complicated. Banding isn't an option for external hemorrhoids because they're, well, external. And for those very severe cases, different treatments might be necessary.
Like surgery.
Sometimes, yeah. But it's important to remember that surgery is usually a last resort when other treatments haven't worked or if the hemorrhoids are causing really serious problems.
Okay, so let's talk about those surgical options for when we need to go down that road.
There are two main types of surgery: traditional hemorrhoidectomy and stapled hemorrhoidopexy. Let's start with the traditional one. This involves surgically removing the hemorrhoidal tissue. It's usually very effective, but the recovery does take longer.
Okay, so we're trading a quicker procedure for a longer recovery. What does that recovery actually look like for someone who has had a traditional hemorrhoidectomy?
Well, pain management is a big part of it, making sure things are kept clean and a gradual return to normal activity. It can take several weeks to fully recover, so it's important to be prepared for that.
What about this stapled hemorrhoidopexy? How is that different?
It's a newer technique using a stapling device to reposition the hemorrhoid tissue. What it does is cut off the blood supply, but it's designed to preserve more of that surrounding tissue. And that can potentially mean less pain and a quicker recovery.
So less pain, faster recovery. Sounds pretty good. But is it the right approach for everyone?
Not necessarily. It really depends on the individual and their specific situation, and this procedure might not be suitable for all types of hemorrhoids.
This is where having a knowledgeable doctor is so important. They can really guide you through the options and recommend the best approach for your specific situation.
Exactly. They'll consider your overall health, the severity of your hemorrhoids, and your personal preferences to determine the best treatment.
Before we move on to prevention, I want to quickly talk about something else our sources mention. Anal skin tags. They often get confused with hemorrhoids, but they're actually a different thing entirely.
Oh, yeah. They're often mistaken for hemorrhoids, but they're really just these harmless little flaps of skin. They usually don't cause any problems, but some people find them a little bothersome.
So if they are bothersome, what can you do?
The good news is that they can be easily removed if they're causing discomfort, or if someone simply wants them gone for cosmetic reasons. And it's a pretty simple procedure, done under local anesthetic, usually right in the doctor's office.
Most hemorrhoids are benign, but it is important to rule out other conditions that might have similar symptoms.
Especially if there's bleeding, right? That can be scary.
Absolutely. Rectal bleeding should never be ignored. You need to get checked by a doctor, especially if the bleeding is persistent, changes in color, or if you have other symptoms like abdominal pain or unexplained weight loss.
So don't just assume it's hemorrhoids. Get it checked out.
I completely agree. Early diagnosis is so important. It can prevent complications and lead to better outcomes.
Makes sense. Well, I think we've addressed some of the biggest questions people have about hemorrhoids. Any final thoughts before we wrap things up?
I think the main takeaway is this. Hemorrhoids are common, they're treatable, and there's absolutely no shame in seeking help.
Don't suffer in silence.
Exactly. Talk to your doctor, get a diagnosis, and explore the treatment options available. And don't forget about those lifestyle changes.
They can make a real difference in preventing and managing hemorrhoids.
We hope this deep dive has been helpful and informative for everyone.
Thanks for joining us.